We're on to learning unit number 5. In this learning unit, you'll see by the introduction that evidence-based health promotion is supported by high-quality data through health promotion research. As a nurse, it's important to be able to locate good and appropriate evidence and then apply it to your practice. And this is whether you're in health promotion or whether you're in acute care practice, it doesn't matter. Across the healthcare continuum, as a nurse, you do need to be able to locate good evidence and apply it in practice. So we're going to look at ways of exploring different types of health promotion data, and you're going to be locating 2 peer-reviewed scholarly articles to support your health promotion group project. And you're going to do that through the library's databases. So you're watching this video right now, and our goals and objectives are to describe national initiatives to promote health and well-being, access credible health promotion literature through the Mercyhurst University Library's databases. And I can't say it enough. This is a requirement that we go through the databases. I know we can get really good data and information by oftentimes even Googling, especially if we go to good sources like the Cleveland Clinic, etc. But for this course and for this specific learning unit, we are going through the Mercyhurst Library databases. And then we're going to use that evidence to impact health in our health promotion groups. So I'm going to walk you through what we're going to be doing this learning unit. So you're going to start by reading chapter 9, but very specifically, I have you reading specific pages, 223 to 228, and then going to 234 to 241. I would like you to come back at 249 and just look at the key terms, but I have not included that here. We start with chapter 9, talking about healthy people. And I want you to review this information, especially Healthy People 2030. But we are going to spend a lot more time next learning unit reviewing some of the sources online about Healthy People 2030. And we're going to get in-depth look at Healthy People 2030. So it's really important that you have a baseline before next week. So I just want to take you to 224 and read just the first sentence on Healthy People 2030. And it states the majority of deaths among Americans are the result of chronic diseases that are preventable through lifestyle and behavior modifications. Now it sounds easy enough, but did you really recognize that fact? That the majority of deaths among Americans, this isn't global health, but among Americans, is the result of chronic diseases that are preventable. And that's why, yes, you're going to be practicing probably to start in acute care settings, in hospitals. Maybe you'll be starting practice in long-term care, such as a skilled nursing facility, or maybe even school nursing. But what I want you to know is that a big impetus of nursing, an important factor of being a nurse, is to promote health promotion. So, and risk prevention. So that's an essential statement to read. Then we're going to go on and look at the United States Department of Health and Human Services, HHS. And there's a lot of change going on, and let's look at that a little bit further. So you've got a fact sheet about HHS, and that stands for Health and Human Services. So if you are listening to the news, you know that there's a lot going on with HHS under the direction of RFK Jr. A lot of changes have been made. People are on both sides of these changes. but I want you to look at the fact sheet that was put out about HHS's transformation to make America healthy again. I realize you can't see all of that. So there are a lot of what could be good changes, a lot of consolidation, a lot of reduction in force, and that includes the CDC that you're reading more about. So, whatever take we have on whether it's a positive or a negative, I do ask that you look at this fact sheet just so that you are informed and that as you read through this information, you better understand HHS. So, okay, so we're going to close out of that for a moment. And then there's another, as we read further, we're going to be looking at a few other things. So the Centers for Disease Control, which is a division under HHS, another huge changes are occurring in the CDC. So I'm sure you're hearing that on the news as well. So then we're going to skip through till we come out at page 233, which you're going to start reading about monitoring the nation's health. And there are two questionnaires, surveys that are going out to large numbers of Americans. And the first is the BRFSS. So you're going to see that on page 234, Behavioral Risk Factor Surveillance System. And you can look through some of the information on that. And then the other one you're going to look at is the Youth Risk Behavior Surveillance System, YRBSS. And this is one of the best ways, I think, to understand some of the information and the data that's being gathered, especially on youth risk behavior, is to look at the actual questionnaires. So we have the questionnaires right here. So I'm asking that you look at either middle school or the high school questionnaire and just start reviewing some of the questions. And then you can read more about both of those surveys at another time or in your textbook. Not at another time, but this week in your textbook. So those are ways in which we can keep informed by watching the news, maybe not, but at least getting some information about what is it that they're doing as far as a program to make America healthy again. What are the changes in HHS? And what are some of these surveillance systems? How are we gathering some of the data? And so these are really interesting questionnaires, and they might be of help to you, especially in your health promotion projects. Not every bit of information that I'm sharing is going to help every single group, but when you get a gem such as this, if you're working with younger students or high school girls that are overweight and obese, these might be great questionnaires to look at. And what the data does show, not just the questionnaires, but after they're submitted to so many students, what are we finding? What are the results of these questionnaires? And so now we're going to go on to make sure that everybody has a foundation in searching the Mercyhurst University library databases. I say it's the easy way. So there's like an 8-minute video that I put together about one of the easiest ways to search the library databases and still get good information. So sometimes if our search terms are just so global, we have, 48,000 or 400,000, results. So we have to narrow our searches oftentimes, but there are easy ways to do it. And I will go over this. And then the next is just accessing. If you click on here, you get right to the Mercyhurst University library, the Hammermill Library. And then finally, well, not finally, but for our discussion board, you're going to using the search engines, Mercyhurst databases, but we're using Mercyhurst Library's search engine as described in the video. Find 2 peer-reviewed journal articles related to your group's health promotion topic. So we're working on things that we're going to utilize, right? So for your initial post, quickly introduce what your health promotion topic is again, then outline or just summarize one article, one of the two, and provide a copy of this article to your post. Attach it as a link, or if you've downloaded a PDF article, just attach it to your post. And then when you reply, you're still going to reply to one of your classmates. If possible, it'd be interesting to reply to one of your group members, right? But maybe you're interested in a different topic too and want to learn from another classmate. So then review your classmate's article and their summary and critique your classmate's written summary. Did they bring you in? Were you engaged in reading their summary? Did they provide an accurate representation of the data? Did they really share what the article said? And is that information applicable to their health promotion program project? So that's the discussion board. And finally, which goes along with it as well, you're going to be doing your collaborative document, but this time topic number 2. We started last week with topic number 1. For this topic, you're going to explore and synthesize the evidence from the literature to support your group's health promotion program. So it's very similar to what you did for your discussion board. I don't have you going all over the place. You're really working towards your health promotion project, but you're learning a foundation of information about health promotion. So every week, just so you know, every week I move your collaborative document to the next week. So if you get on early Monday morning to do your collaborative document, it may still be in the previous week. I will try my best to get that moved down. So I just move the whole folder every week. So again, if that makes sense to you, every week or most weeks over the next couple of weeks, we are going to be working on the collaborative document. We'll have a different topic each week, but it's the same document. And you will have access to that document, including my feedback, when you go to do your health promotion presentation. So again, we're working towards a goal, and I'm not having you do all this extra work. We're working towards a goal, and you're using the information that you find. So that's learning unit number 5. Any questions? And make sure that your group has a date and time set that all 3 members of your group can meet with me either this week, learning unit number 5, week 5, or next week, week 6. So make sure, because that's worth 60 points. So you want to make sure that everybody gets together. Once in a while, there's a problem that one member cannot attend. If you have done everything to reach out to one member and they can't make it, well, then you're going to have to go with 2 members, and then that other member, unfortunately, would get a 0 for the meeting. But do your very best to work together, to collaborate, which is essential in nursing, and schedule a time with me, because that is important and very beneficial to you guys as well as to me, to make sure we're all going down the right path for our health promotion projects. Thanks.